Compassion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA presents this week's breaking news in wellness and in health for all people and for all professionals. Hi, I'm the Pete of Dr. Z and Pete. I am presently the president of Bethel House of Refuge, Muhammad, Illinois. Prior to that, I was the owner-operator of a commercial construction business in the East Central Illinois area. My wife Stephanie and I, who works at the University of Illinois at the Electronic and Computer Engineering Department, we live in Farmer City, Illinois. This is my good friend, my distinguished co-host, Dr. Alex Rama Zachariah, MD. Doc is also a medical professor, and as I mentioned, he is the CEO of CNN4All International. Recently, Doc was the Chief Medical Officer, the Medical Director of Provena, now President's United Medical Center in Danville, Illinois. In 2008, all of 2008 and part of 2009. Prior to that, he was the Dean of one of the top 12 out of 300 medical schools in India, Christian Medical College in Ludhiana, India. Doc and his wife Prema, also a retired physician and professor, spent 43 years at Christian Medical College in Ludhiana, first as medical students and as faculty until their retirement in the year 2000. They are now residing in Urbana, Illinois, where they've been since 2005. Doc, great to have you with us. I'm really blessed with your outstanding experience and resume, and privileged to be having you here as a co-host with this week's Breaking News in Wellness and Health. And I need you to tell our audience what we're about here.
Please note that this is not medical advice. This is for your information only. Do not change your treatment based on this info. You may mention this to your physician, or you can, better still, you can ask him to watch.
Yeah, ask him to watch. Come on, Doc, watch. If you need to communicate with us, you can do that via email. We're in the 21st century, so we do have an email address. It's breaking news at CNN4All. That's breaking news at CNN4All.com. We're going to jump right into it this week. We're talking about some important stuff. Sedentary behavior is linked to the recurrence of precancerous colorectal tumors. Men who spend most time engaged in sedentary behaviors, couch potatoes, are at the greatest risk for the recurrence of colorectal adenomas, benign tumors that are known precursors of colorectal cancer. There is extensive evidence supporting an association between higher overall levels of physical activity and reduced risk of colorectal cancer. Get up off your seat, the couch, everything, right, Doc?
Absolutely. This is according to results presented here at the 12th Annual AACR International Conference on Frontiers in Cancer Prevention Research in October last year. The analysis showed that men who reported high levels of sedentary behavior, just sitting, and low levels of participation in recreational activities such as walking, jogging, and playing golf, they were 21% more likely, the one who is sedentary, more likely of having recurrence of colorectal cancer compared with men who reported low levels of both sedentary. In other words, they moved more.
Yeah, they were out, exercise more, right?
Yeah.
That keeps coming back to us, folks.
Yes.
Okay, weight at the time of diagnosis linked to prostate cancer mortality. Men who are overweight or obese when they are diagnosed with prostate cancer are more likely to die from the disease than men who are of a healthy weight, according to the study we're going to hear about.
According to Kaiser Permanente study published in the journal Obesity Research and Clinical Practice, these patients with more aggressive forms of prostate cancer, the researchers also found an even stronger correlation between obesity and mortality.
Doc, we keep coming back to this obesity and the connection to mortality on a variety of arenas. Okay, staying ahead of influenza. That's what we all want to do. Every fall, the latest batch of flu vaccines attempts to keep society a step ahead of the evolution of the flu virus. And these flu viruses are pretty evolutionary. Heroic worldwide surveillance efforts have avoided a repeat of the 1918 flu pandemic. But as shown in the H1N1 outbreak recently, viruses can still outwit even the best public health efforts.
They are smarter.
You bet.
According to Molecular Biology and Evolution, Oxford University Press, UK, 2013 journal, most of the mutations leading to influenza drug resistance are on the wane, so that recent efforts in controlling drug use are paying off. But we should remain vigilant.
Yeah, we got to stay on top of that. Flu is everywhere at this time of year. Okay, we're going to move on to dinner rituals, and they correlate with child-adult weight, in how you eat, when you eat. Families that eat together without the television on and stay seated until everyone's finished have children with lower weights and BMI, or body mass index, our study reports.
What they haven't mentioned, they sit together, they pray.
Oh, yeah.
The study from the Cornell, these dinner rituals correlated with both the parents and the child's BMI. The higher the BMI of parents, the more frequently they indicated to eat with the TV on.
Ooh.
Eating at the table in the dinner room or kitchen was linked to a lower BMIs for both children and parents.
Boy,
so
that
get back
means
to the table.
That's exactly
Switch
right.
off the television
You
set.
bet.
And pray for the food.
Right, and interact with one another.
Yes.
You know what I think happens as you're interacting? You're not just shoveling it in.
Yes.
Okay. Good cholesterol controls blood glucose. HDL, high-density lipoprotein cholesterol, the so-called good cholesterol, improves blood glucose levels by enhancing skeletal muscular function and reducing adiposity.
All the more reason to exercise.
What's adiposity?
Yeah, the scientists of the Helmholtz syndrome Munchen from Finland report
That was pretty good.
in the renowned American Heart Association journal Circulation 2013 that women with type 2 diabetes, their risk for cardiovascular disease compared to men with type 2 diabetes is significantly increased because these women have low concentration of HDL cholesterol, ApoA1,
Polyprotein.
Lipoprotein, yes,
Yeah.
the major protein component of high-density lipoprotein in plasma. The protein promotes fat efflux, including cholesterol from tissues to the liver for excretion. It's a scavenger, HDL. It sort of eats up the bad cholesterol.
Well, that's good.
Yeah.
We have pit bull HDL now.
Yes.
All right. High protein diet. Meal replacements can reduce rebound weight gain. Karolinska Institute, Sweden. New research shows that there are several effective strategies available to people wanting to avoid getting porky again, regaining weight after a successful diet. Anti-obesity drugs, meal replacements, a high-protein diet can help maintain weight loss. That's the key, isn't it?
Absolutely. Published in the scientific periodical, the American Journal of Clinical Nutrition 2013 showed that even though the study shows that the rebound weight gain is more the rule than the exception, the researchers found that several strategies obviously help to reduce the unwanted effect.
My goodness, well, that's great. All right, check this out for you pregnant ladies, pregnant women who snore are at a higher risk for C-sections, delivering smaller babies. That's the hypothesis. Snoring during pregnancy may be more than a nuisance. Mothers who snored 3 or more nights a week at a higher risk of poor delivery outcomes.
Reported in the journal Sleep 2013 that chronic snorers who snored before and during pregnancy had the highest risk, being more likely to have smaller babies and elective C-sections. Meanwhile, those who started snoring only during pregnancy had higher risk of both elective and emergency C-section, than women who did not snore.
Boy, that is interesting.
Yes, so all pregnant women and their husbands take
Oh,
note.
that's exactly right. All right. Increasing rate of knee replacements linked to obesity among the young. Contrary to popular myth, it's not the aging baby boomer, Doc, or the weekend warrior that's causing the unprecedented increase in knee replacement surgeries. Data gathered by more than 125 orthopedic surgeons from 22 states across the U.S. show a more mundane culprit. Raising rates of obesity. Rising rates of obesity among those under the age of 65 appears to be the culprit.
This study from the University of Massachusetts Medical School, knee and hip replacements are one of the most expensive and most used surgical procedures in the nation. Total joint replacement. This study shows that younger patients are more obese and experience the same amount of pain and functional disability as older patients, and in some cases even more. Okay.
Well, listen, I understood that. I got knee issues myself, so I'm going to have to slow down. Fast, painless alternative fibroscan to liver biopsies proves accurate and reliable. You probably know about that. A non-invasive alternative to liver biopsy called fibroscan, now the standard method of diagnosing cirrhosis and in hepatitis patients, provide very reliable in a national multi-center study. These fibroscans exceptionally reliable.
This is such a good news. You know, I used to dread doing this, poking into the eluding the liver biopsy. The study from Henry Ford inspection that fibroscan replaces liver biopsies with a quick, painless procedure similar to familiar ultrasound test.
Yeah, boy, that'd
just long used to diagnose track pregnancy and all the ultrasound disease. Fibroscan device exhibits excellent reproducibility, which makes it a reasonable alternative to liver biopsy. That's good news. Really
That's very good news.
Good news.
In a new study, munchers and skippers display compensatory patterns of consumption in response to positive and negative social situations. That's people that are munching all the time or skipping meals, okay? Munchers and skippers. While munchers in the study ate more after being stressed, they ate less in a response to a positive situation. Skippers actually showed the reverse pattern. They were eating more after a positive experience. What's up with that?
That's interesting. Published in Psychological Science 2013, the study from Germany challenges the simplistic view that stress eaters need to regulate their eating. Well, it needs to, but eating behavior to prevent weight gain. Both skippers and munchers have their soft spot for food. They just show different compensatory eating patterns in response to positive and negative situations.
So skippers eat in a positive situation and munchers don't.
Yes.
So you have to know what to avoid and what to take care of. Okay, listen, we want to thank you guys for watching us. We'll be back soon. We have our expert, Dr. Ross, joining us, and we're going to have a three-panel discussion. We'll be right back.
Every day, thousands of people are diagnosed with macular degeneration, a disabling eye disease that leads to severe vision loss. As a scientist conducting research for the American Health Assistance Foundation, I want you to know that there is hope that a cure and new treatments for macular degeneration will soon be found, but only if we can continue our groundbreaking research. Learn about my research. Call 1-800-437-2423 or visit ahaf.org.
Compassion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA. We're back for our panel discussion. Of course, you know I'm Pete, and this is Dr. Z of Dr. Z and Pete, and we are joined by our distinguished medical expert, Dr. Ross Yoha.
Thank you.
Welcome, Dr. Ross. It's good to have you here. Today, we're going to be discussing men's health and
Yeah,
particularly,
we three men here.
yes, prostate cancer. You've heard about that, right? I need you, Dr. Ross, to give us some information. Tell us something about prostate cancer, how it works.
Oh, thank you. Prostate cancer occurs mainly in older men. About 6 cases in 10 are diagnosed in men aged 65 or older. It is rare before the age of 40. The average age at the time of diagnosis is about 67. What do you think? Yeah, I agree. Prostatic cancer is the second leading cause of cancer in the American men, behind only with lung cancer.
That's smoker's cancer.
Yeah, smoker's cancer. About 1 man in 36 will die of prostatic cancer. Prostatic cancer can be a serious disease, but most men diagnosed with prostate cancer, they do not die
From prostate
from
cancer?
prostate cancer.
Yeah.
In fact, more than 2.5 million men in the United States who have been diagnosed with prostate cancer at some point are still alive. They are? Yeah.
Well, I know a couple guys that one of them's, well, both of them are over 65. One of them has had it for 15 years, and he's still doing very well. So,
He's alive and kicking.
oh, yeah, alive and kicking. Okay, where's detection in all this? Is there early detection? What are the things that can be done, Dr. Ross?
You know, prostate cancer can often be found early by testing the amount of prostate-specific antigen. You know,
PSA?
PSA, you got it.
Yep.
In a man's blood, another way to find prostate cancer is the digital rectal exam, DHE, screening, in which the doctor puts a gloved finger, I hope,
Yes.
into the rectum to feel the prostate cancer. Prostate cancer found early with screening. PSA blood test can help to find early prostate cancer. Finger exam of done by your physician is also a good way to diagnose prostate cancer.
You know, there's a lot of stuff going on, Dr. Ross, about the ineffectiveness or unreliability of PSA screening. What are your thoughts about that?
You know, that's very interesting. There are a lot of controversy. But the study done in the United States found that annual screening with the PSA and DRE, digital rectal exam, detected more prostate cancer than those who are not screened. But it did not lower the death rate from prostatic cancer because they die of something else. A European study did find that lower risk of death from prostatic cancer with PSA screening, and that about 1 in every 4, the risk is they could live longer. The researchers established that about 10-50 men would need to be invited to be screened and 37 treated to prevent 1 death from prostatic cancer. It may be a to find the kind of needle in the stack kind of thing.
Oh, I mean, 1,050
Yeah.
screened and 37 treated. That would be needle in a haystack, right?
Yeah.
So what do you think, Dr. Ross?
Yeah, neither of the studies have shown that PSA screening helps men live longer, lower the overall death rate. That, still, we recommend this. Okay, can I sing a song?
Sure.
Prostate cancer found early.
Early.
With screening of blood test. Okay, PSA blood test find in the blood can make early prostate diagnosis Finger exam of rectum, the and also health is a good way to find prostate cancer. Now go ahead, get it done.
Okay, well, I'm over 60. Matter of fact, I just turned 63. I had my birthday last week.
Congratulations.
So, but I've only had this done once. And my physician I had just talked to her the other day, and she said, you need to come in and do your annual examination. So that'll be a digital rectal exam and a PSA screening.
Got it.
Now, these are preventative things. This is early detection things,
That's right.
I mean, some guys get the idea that if you do all these things and you do find out that you have prostate cancer, that the screening somehow is going to lengthen their life. But what it is actually the screening gets them on top of it immediately, as opposed to ignoring it and think it'll go away.
You
Is that
got
right?
it. You got it.
Yeah, so we really have to, what are the things we can do? I mean, diet has to help, right?
Absolutely, and healthy lifestyle choices.
Okay.
Eat well, yes, eat more, more of veggies. Whole grain fruits, go nuts on nuts.
Oh, yeah, I like that.
Eat less, yes, eat
Less.
less. Less of sugar, starch, fried food. Say no to soda pop.
Right.
Exercise more.
Exercise
Walk, jog,
more.
run, bike, treadmill, elliptical, till soaked in sweat. Exercise more, 5 times a week, half hour or more, till soaked in sweat.
Man, you must have taken your Pavarotti pills today. You're
Thank you,
sounding
thank
good.
you,
Yeah.
thank you.
Well, all right, so here we have it. We've had our little exercise with Dr. Ross. Pay attention to what you hear. Digital exam, PSA screening, men. These are going to work to help early detection and really give you the upside of fighting against prostate cancer, right,
And
Dr.
get
Ross?
your annual exam, as you
Get
mentioned.
it. Absolutely annual exam.
Your blood cholesterol, good and bad?
Yes. This is treat yourself, right?
Absolutely.
Exercise more.
Absolutely.
More veggies, fruits, go nuts on nuts.
Nuts.
Less fried food, sugar, starch, say
Got
no
it.
to soda pop. Get your treatment working at home first, right, Dr. Ross?
Excellent.
All right, well, listen, it's been a good discussion. We appreciate your input, and thank you for all that you bring to the table. Dr. Rama, we're glad that for your part in all of this. We're thankful, and we would like to thank Science Daily for all the info that they give us for this program. Also like to thank the City of Urbana, the UPTV station production coordinator, Jason Liggett, our intern, Caleb Serpentis, and we have a 3-camera intern, Jacob Bernard, and the UPTV station manager, Jake Schumacher. I'd also like to thank Dr. Rama for all his able assistance. We'd like to thank the Chorister Fellowship from Tiruvalla, Kerala, India for the music score and for the Hallelujah ending.
Hallelujah.
And we'd like to thank you all for being with us and watching every week. And we'll see you next time.